Hi, my name is Dr. Kappus. I'm one of the bariatric surgeons here at Niagara Falls Memorial Medical Center. The most commonly performed bariatric surgeries would be the laparoscopic sleeve gastrectomy and the laparoscopic Roux-en-Y gastric bypass. The sleeve gastrectomy has gained popularity and is currently the most popular weight loss surgery in the United States because of its safety, both in the short term and long term. And basically what that entails is taking the full-size stomach and stapling it down to a smaller size so that when you eat food or liquid, your stomach is smaller and you feel full faster. This leads to decreased food intake, decreased caloric intake, and subsequently weight loss. The other interesting part about the sleeve gastrectomy is that when we staple off the stomach, we remove the excess portion of stomach that used to contain or used to be able to serve as a reservoir for large amounts of food and liquid. When we remove that portion of stomach, we're also removing cells that are embedded in the wall of the stomach that produce a hormone called ghrelin. You may have heard of that hormone also referred to as the hunger hormone. So by reducing those cells that produce the hunger hormone, you'll feel less hungry. So while your stomach is smaller and you can't take in as much food, you also don't have those hunger pains as much because we've reduced the cells that produce that hormone. That's a nice added benefit of getting the sleeve gastrectomy and something that our patients really enjoy the side effects of. The other second most popular bariatric surgery is called the Roux-en-Y gastric bypass, and that has two main parts to it. First, we create a very small stomach, very similar to with the sleeve gastrectomy, and we call that the new gastric pouch. Again, with creating that small stomach, you fill it up faster and you feel less hungry or you feel full quicker. So you take in less food and less calories. The second portion of the surgery involves rerouting the small intestine to bypass an area of the small intestine where a lot of absorption of nutrients occurs. By bypassing that segment, in addition to you taking in less food and less calories, you also absorb less of what you took in. And because of that, you also get a large amount of weight loss. The Roux-en-Y gastric bypass might be particularly useful in patients who have issues with diabetes. If you have diabetes and are on high doses of insulin, the gastric bypass can be successful in helping you to decrease your insulin needs or decrease your medication requirements, and in some cases get you to a level where your diabetes is just diet controlled. The other nice thing about the gastric bypass is that it can reduce acid reflux. So if you're a patient that suffers from severe heartburn or acid reflux, the gastric bypass can simultaneously relieve those symptoms. Bariatric surgery is something that's been around now for at least the past 20 to 30 years. And because of that, through modern medical advancements and surgical advancements, we've been able to get to a place where bariatric surgery is actually extremely safe. It would be equivalent to having your gallbladder taken out, for example. So the risk of a serious complication is very low. If you would like to make an appointment to see us in our weight loss center, just give us a call at 716-278-4400 and we'd be happy to make you an appointment. First, you will be assigned to an informational session, which may be conducted online via Zoom or by pre-recorded video, or may be conducted in person. And after that, about 24 to 48 hours later, we will be calling you to schedule you for your first meeting with the surgeon, either Dr. Pham or myself.